Good morning, Doc Rob here. Now today I want to talk to you guys about, these structural misalignments that take place and how we go about finding these misalignments. There's many ways we can find misalignments. We could obviously take x-ray, which is taking a picture of the spine. There are thermal reading machines where we can see if there's muscle spasm, if there's edema around the joint. So there's many ways. Today we're going to find these misalignments through palpation, motion palpation, and then we're going to adjust particular joints that we're talking about. So with our patient here today, we can see just by looking here at her pelvis that it's not level, it's not even, it's actually higher on one side. Then you can tell by how the feet lie here, this foot flares in. Okay, so we can do some testing and we can identify the locked joints. So the feet flaring in, the short leg, this tells us that her pelvis is not in a proper position. So when she sits for majority of the day, all the stress of the seated position is accumulating on her spine and is creating abnormal stress in these particular joints. That's going to affect the joint, it's going to affect the nerve, and it's going to lead to muscle spasm, weakness, fatigue, injury. Particular nerves that communicate to organs like the reproductive organs, the large intestine, up in here, the stomach, those organs are ultimately going to be affected because the nerve is compromised. So this leads to symptoms. Also, these pelvic misalignments here affect the knees over time. So when we're 40 and 50 and we have knee pain, it was because our pelvis was out of alignment most of our life. We were walking around with unequal weight distribution on our joints. That leads to abnormal stress, which leads to decay. We call that osteoarthritis. So all of these things that we start to deal with as we go through life are a result from the misalignments that have been there most of our life. Lie on your side, facing me. Okay. So we identify these joints that are not moving right here, this left hip joint and the L5 vertebra. I want you to take a deep breath in, and you're going to exhale. Good. Very nice. Okay, now you're going to lie on your back face up, just like that. Good. Good. We're also going to do a little joint movement here. Just relax. Good. Good. So what we're doing is we're restoring the motion to the joint, reducing the stress on said joint, improving joint and nerve function, allowing the body to start to function better, helping obviously the pelvis, the lower back, the lumbar vertebra, the knees, the muscles, the organs I was referencing earlier. Everything starts to function better, and the particular symptoms that she was dealing with start to go away as we achieve a better spinal alignment.